Wonderful. Thank you, Annie. Nice to meet all of you. So my name is Stefanie Ricchio. I am a CPA, and really quickly, I've been a financial literacy volunteer with CPA Canada, which is how this session really came to be. But I do have a personal connection to this because I have a son who has ADHD. And, that took a significant toll on me, obviously, as his mother. And I wanted to put something together to help the community just to understand what it actually takes to be successful in this process, because applying for the disability tax credit for ADHD or any other neurological disorder is very different than when you're applying with a physical impairment. And so that's how I kind of got here, because of my son and my background as a CPA. That's why I built this webinar. And having said that, I'm going to get right into it. I'm going to turn off my camera just while I'm doing the presentation, so I'm not distracted by my own face, but I will turn it back on towards the end. All right. So what we're going to cover today is the CRA definition of a disability, which is really important because it's actually what people don't really understand is that it's very different than what most of us consider a disability to be. We're going to look at the actual disability tax credit form. And this is important because as you go to your medical professionals to try to get them to complete this form for you, the more you understand what the CRA is looking for, the more you can be successful in this process. We'll briefly just cover some of the other credits that are available to you. We'll talk about the difference between claiming medical expenses and claiming the disability tax credit. And then, of course, we'll talk about some of the tools and resources available and some of the frequently asked questions that have already come up as I've delivered this program quite a few times. So we will kick off with the CRA definition of a disability. So you or I might think that being diagnosed with ADHD is enough to qualify as a disability. But for the CRA, for a tax and benefit distribution perspective, that's too broad. So what they want is something, they're looking for a very specific formula. So they start with the box that's on the left. So what they say is that an individual who's applying for the disability tax credit has to meet one of these items in the left box. So either you are blind, you are markedly restricted in at least one of the basic activities of daily living, and we'll cover what those are, or you are significantly restricted in at least two or more of the basic activities of daily living, or lastly, you need life-sustaining therapy. So the first criteria that you have to hit is one of these bullet points on the left. If you pass that criteria, then it's the box to the right, and an individual who's applying for the disability tax credit has to meet both of these items. So the first is that your condition is prolonged. What that means for the CRA is that your condition will last a minimum of 12 months. So if you cannot get a medical practitioner to attest to a minimum of 12 months having the condition, you will be disqualified from this application process. And the second part, or the second point that you have to meet, is that the condition is present all or at least 90% of the time. So the individual is affected by their disability at minimum 90% of the time. And again, it's important because when we look at the form and what needs to be filled out, if you can only get a medical practitioner to attest to 30, 40, or 50, 60% of the time, again, they will disqualify your application because the minimum that they're looking for is a 90% presence. So high level, this is the formula that the CRA is looking for when they're reviewing your applications. One on the left at minimum, plus both of them on the right. I wanted to throw in, this slide is just, I'll cover maybe the first two, just to kind of get a sense of the language that the CRA is looking for. And again, why this is important is because as you go talk to your GP or a developmental pediatrician or a speech and language pathologist or a psychologist or an occupational therapist, they need to really hit on some particular language and markers in order for you to be successful. If we look at the first example, Morgan is a 10-year-old with a learning disability and executive functioning concerns. They have a homework assignment that should take about 45 minutes. In order for Morgan to complete the task, their parents must remind them the moment they get home to take out their homework. Their parent must monitor them while they do the assignment, reminding them to stay on task as they get distracted. Then their parents must review the assignment to ensure it is fully complete and assist them if it is not. After completion, the parent must help Morgan remember to pack the completed assignment in their backpack and remind them multiple times to ensure they turn it in the next day. The total time from start to finish on this task is almost 2.5 hours, more than triple the time for the average student. This classifies as markedly restricted. So again, in this particular example, we probably have an identified and documented learning disability. We have an additional factor, which is executive functioning concerns. What's really important for the CRA is really this piece here, the very last line about it taking this particular applicant 2.5 hours, which is more than triple the time for an average student. And this is really what the CRA is looking for when your medical practitioners are filling out the application, the paperwork. They want to know for yourself, or if you're here for a dependent child, they want to know in comparison to an average student, a student who does not have a diagnosis, how much their life is impacted by the diagnosis. And that's really what they're looking to measure and assess as you build this application and give them all your backup and documentation. I'm not going to go through the next two just for the sake of time, but you're going to get this so you can read through them. Just again, focus on the areas that are bolded so you just understand the language that that is really important and what they're looking for when you're explaining or when your medical practitioners are explaining in the documentation. And that brings me into the next point. Something that comes up quite often is what happens if my doctor won't complete the application form. What's important for you to know is that it doesn't necessarily have to be a GP who completes the form on the behalf of the applicant. So it could be your GP, it could be a developmental pediatrician, it could be a nurse, an optometrist, audiologist, occupational therapist, physiotherapist, psychologist, a speech and language pathologist. The CRA has a list on their website to tell you exactly who qualifies and is more than able and certified to complete the form for you. So if you are someone who is in one of those situations where your doctor isn't willing to go through the completion of the form for you, you may need to explore someone else within your team who will do this for you. The next key component is understanding what the CRA calls the basic daily activities of living. On the form itself, they have 8 high-level categories. So vision, speech, hearing, mental functions, walking, eliminating, feeding, and dressing. For the purpose of neurological disorders like ADHD, it's really the top 4 that are the ones that you want to focus on, unless there is actually a significant impairment in any of the bottom 4. And if that's the case, that will actually work in your benefit to add to your application process. It'll help make you more successful. But traditionally for ADHD, it's the top 4. So any issues with vision, hearing, speech, or mental functions. What will happen is you will go to your qualified medical practitioner and you will tell them that you want to start the process of completing the T2201. And it's I think a 14, 15 page document that needs to be completed. Yourself as either the applicant or the parent of a child, you only need to really fill out the first half, which is the particulars of name, birth, address, so on and so forth. But even then, a lot of the medical practitioners will obviously complete that for you. The rest of it is really in the hands of those practitioners. And it's very, very specific. And I wanted just to kind of walk through what it is that the CRA is looking for. And I'm going to focus just on really those 4 top quadrants that are most relative to ADHD. So in this first scenario, this is just the actual excerpt from the application form with respect to the function of vision. And so what you can see here in the right is we need a strong and detailed assessment of the left eye's function, the right eye's function, all of the various parameters that go in assessing someone's vision, and if they have any issues. And some of the most common types of vision issues that children or adults, or anyone rather, with ADHD could have are just general eye health and refractive problems, functional vision problems, perceptual vision problems. And what we see is that it presents a lot with individuals who have ADHD, autism, who may be those who may be nonverbal, and those who may have visual motor deficits. And again, you can't really go to a GP for this kind of information. So you can leverage your optometrist or even an ophthalmologist to complete and prepare the documentation for this particular basic daily activity of living. So just to give you a sense of, if you have issues with your GP and they're not willing to do the work for you, you can leverage these additional partners to help you to just get the backup that you need to be successful. You don't have to depend just on one person if that's not working for you. Next, of course, when you think of ADHD, speech and language and learning disabilities obviously comes into play. So there's a segment, of course, within the application itself on speaking. And again, we get into the details of, does the individual have any diagnosis of any medical condition that's affecting their ability to speak? Is the individual on any medication, or do they need aids? And this is the information that helps the CRA assess if you, by comparison to the average person, are charting more restricted than the other person, right? So if you do need a device, if you do need therapy, if you do need medication, these are all points and factors that will demonstrate to the CRA that without that support, compared to the average person, you are not able to perform in the basic daily activity of speech and language, okay? And so again, speech issues could be things like speech impairments and, of course, language-based learning disabilities. And who can support you in this process would be a speech and language pathologist. And what's also important is these charts. So at the bottom of each of the various categories that are going to be assessed or could be assessed, we have a severity chart and we have a frequency chart. And this is, again, where the qualified professional is going to tell the CRA, this person is moderate to severe or severe, which the CRA will know means that the impairment or the restriction is much more serious. If your medical practitioner is only willing to attest to mild, then you know relatively soon in the process that you're going to have a hard time getting approved if the practitioner is not convinced that the issue that you're looking at or assessing is actually severe. And then the second part to the right here, which is called frequency, the CRA, again, if you remember the formula, they want to know how often this issue or this impairment is present. And again, if your practitioner is only willing to say rarely or occasionally, that's likely not going to hit that point that we had of being present a minimum of 90% of the time. So that's why it's important, and I wanted to make sure that I had this in the presentation, is that you understand the way that the CRA is going to be looking at the information. So as you're meeting with your practitioners and talking about what they're willing to attest to, you can get a sense of where you're going to land in this process, or you can talk to them about having a different opinion in terms of what they think that they want to put in the report for you. Similar to the first two, we have hearing and learning, obviously as part of the basic activities of daily life. And again, super specific measurements and testing for the left ear, the right ear, whatever percentages, that they need to run as their assessments, the audiologists or hearing test centers. And of course, again, if you or a dependent child needs to use a hearing aid or potentially cochlear implants or anything, document it all, because again, this will show that the individual has a greater restriction than the average person. So even if you think like it's an insignificant fact, have it all put in here, because the more you provide, the stronger case that you're making. And again, you're going to look at the severity and the frequency charting and talk to the medical professional to get a sense of what it is they're willing to attest to. Okay. And just again, good common areas that are found, hearing loss and auditory processing disorder. And I will explain this in further detail in 2 slides coming up. Then the last quadrant that is probably the most relevant for all of us here today is the mental functions, basic activity of daily living. And this is where ADHD, for example, lives within this particular application process. So we know that, you could have adaptive functioning issues, you could have executive functioning issues, you could have memory issues that could all be combined as part of an ADHD diagnosis. And this is where that level of information needs to be built out and thoroughly explained. So if you are someone who is tracking how long it takes you to do X, Y, or Z, or what your memory is like, or anything of this sort, whatever you have and whatever your qualified medical practitioner has in terms of assessments and documentation, it will live within this component of the application. Having said that, this is also probably one of the most challenging areas of medical assessments, I will say, because you really have to do a lot of work to go and get these types of evaluations done. Typically, you're going to need to get this done from a psychologist. This isn't an assessment that a general practitioner is going to do for you. I don't believe, I could be wrong, that a GP is actually not a person who can confirm an ADHD diagnosis. I know that wasn't the path that I had to take with my son. And there's a lot of work that goes in behind it to get that diagnosis. And that's the individual that you want to be able to complete this particular portion of the application for you. We know that specific to students within the education system, that getting a neuropsychological evaluation done, if you have to go the free route, once upon a time, it took about 18 months of the wait list to be able to get one done. It's potentially upwards of 2 years maybe, or if you're able to pay for it out of pocket, you can expedite that process. But again, this is this particular assessment portion is very lengthy. This is not something that you can get done within one quick visit to a doctor's office. So you have to, if you haven't done this piece yet and gotten this level of documentation to support your ADHD diagnosis, this is going to take a little bit of time to get and collect all the data that you need behind it, and to really get the level of detail in terms of brain function that is going to be needed to be successful just with the mental function. And that's really what's important in this process to understand. If we remember in the first box of the formula slide that we went through, we said to be successful, you have to either show that you are markedly restricted in one area, meaning markedly restricted in mental function, or hearing, or speech, or vision. Or you can be significantly restricted in 2 or more. So it could be mental plus vision, mental plus hearing, or mental plus speech, or even 3 of them. And why it's important to explain that is, if you think that you might have a hard time just with an ADHD diagnosis to be successful, it's in your best interest to think about getting hearing assessments done, speech assessments done, and vision assessments done, because it'll add backup and support to your claim. So if you're not able to hit the strong restriction in just one area, then you will find success potentially in showing multiple restrictions in 2 or more. And that's, I think, part of this process that a lot of people don't understand, is that to just, I'll say, win in the application process with an ADHD diagnosis can be very difficult unless there's a lot of sub brain functions, I'll call it, or cognitive functions that your psychologist or a developmental pediatrician or whoever it may be needs to attest to. So you have to think a little bit outside of the box in terms of what it takes to be successful. And then again, I just wanted to list, for the sake of getting your minds thinking a little bit more, mental function. So the ADHD diagnosis plus language processing issues, visual spatial processing, visual motor issues, phonological issues, processing speed, working memory, executive function. A lot of these things are common and go hand in hand with the ADHD diagnosis. So the more you're aware of what you can add to the application, then again, the stronger your case will be. And I know that this is a lot to digest, and I'm going to walk through the example that I was successful in to try to make it visually bring it together for you. So the last item that I wanted to talk about was another potential way that you could be successful in this process is if you met the criteria of needing life-sustaining therapy. And I just wanted to kind of explain what that meant. And basically, it's if you need support to be able to function on a daily level at a minimum of 14 hours per week, you're getting some kind of support, or else you will not be able to live your daily life. That could qualify in itself for a life-sustaining therapy, and you could bypass these first 3 potential criteria and just be successful if you can show that. And again, it's being able to demonstrate that in one of the core areas of daily living, that on your own you cannot execute that particular function. And then just I wanted to put down here, because I know that there are some parents as well, examples that are eligible and ineligible activities that might qualify for the 14 hours per week. Time that you have to spend with a child to help them perform some of the activities of daily living. If you track that and you can, substantiate and corroborate that at minimum you have to spend 14 hours per week to be able to allow a dependent child to, execute some of the daily functions of living, then, you could use this as a basis to be successful under this particular criteria. Okay. So I will show you now what this meant for my son, so that hopefully it just kind of, like I said, comes together in terms of what success looked like for us and how we had to get here. So in 2012, my son was diagnosed with ADHD. And a year or so prior to that, a lot of things we noticed were very wrong. So he wasn't speaking. So one of the first things that we noticed was that the speech wasn't coming, and then he had speech impairments. We learned when he was 3 years old that he actually had moderate hearing loss. In and around 3 or 4 years old, he sustained an eye injury, a head injury, which impacted his vision. And then again came the ADHD diagnosis. So by the time that my son was 4 years old, he had restrictions in these 4 basic functions of daily living. And I probably could have been successful just without the ADHD, to be quite honest, based on what we were dealing with these other issues. But, we had documentation, a few years worth from speech and language pathologists to support the speech function. We had tons of assessments from his eye doctors, his ophthalmologists, his optometrists. For hearing, we spent multiple years in and out of hospitals and multiple surgeries and multiple ENTs. And this was all clearly well charted. So again, with that severity and that frequency charting, it consistently showed that he had moderate hearing loss that was not improving. So again, remember, you also have to show that prolonged criteria, meaning that the condition is present for at least 12 months. And so he struggled with speech for multiple years. His vision struggled for multiple years. His hearing struggled for multiple years. So we were able to show that he was able to meet those the criteria in that far right box. And then again, because of where he was charting in each one of these functions, we were able to demonstrate that significant restriction in multiple categories. And ultimately, we were successful on the first try of our application process. And it took a lot. And I would say that our folder that we sent into the CRA was probably an inch or so thick. I sent everything that I had available to me, just off the first time, instead of holding back, because the process, takes a little bit of time for them to go through and deal with. So it's not really worth it to not send them documentation early on. It just delays the process that much longer. So again, I had, documentation from these 4 areas, plus I was working with occupational therapists, plus I had him enrolled in numerous community programs who were always, documenting and assessing him. And then ultimately I was able to get his GP to sign off on the documents for us, but it was really hard for him to deny it because we had so much that was going on and so much backup to support the claim that he felt like it was worth going through the process with us to complete. But it was a lot of work to get it done. And the other thing that we did was, I didn't even really think about the disability tax credit when he was diagnosed in 2012, which was the majority of when all of this stuff was going on. I only after, because he was diagnosed, and then we just went into many different levels of therapy and treatment and work with him, that I wasn't really thinking about it. And it wasn't until 2015 or 2016 that I said, okay, I'm going to go ahead now and apply. And I applied in 2016 and was approved, but the actual start date of the claim is 2012, which is when he was diagnosed. And I will talk through that a little bit in the slides to come, but I want to make sure that that's clear, that the date that you get if you are approved is actually the date of diagnosis, not the year that you send in the application form. And why that's actually important is because there's an expiration date that comes back with your disability tax credit application, and the expiration date is not effective the year that you apply, it's effective the year of the diagnosis. Having said that, you are also able to go back X amount of years, up to 10 years, to claim. So in my case, he was diagnosed in 2012. I applied in 2016. Once I got approved, I went back and adjusted the previous 4 years tax returns, made the claim, and they sent me back a very healthy check in return. So it's important to understand that if you are applying, there's a box on the form that says, do you want to retroactively apply? You always say yes, or else you're leaving money on the table, because they always go back to the date of diagnosis and not the year of application. So that's really, I know it's a lot of information, but believe me, I completely understand. But that's, high level, the specifics of what they're looking for in terms of the formula and the documentation. So now what happens after, you send in the application and you get approved? What you get back is a copy of the application form that you sent, and it has a stamp on it that says approved, and it has the expiry date. And that's wonderful. And so what that means is, what tax year you have to stop applying. And that you can now go ahead and, like I said, make any retroactive adjustments to previous tax years and also advise whoever's preparing your tax return in the current year that now you are able to claim this particular tax credit going forward. What's also important to recognize is that the CRA says that if your medical condition changes, you are obligated to stop claiming the disability tax credit. It's something that is self-governed. The onus is on you as an individual to acknowledge if an impairment is no longer impacting the basic daily functions of living, and whether or not you should actually be claiming the DTC. It's very difficult for them to enforce, but it's my responsibility to make sure that you understand that is the expectation. And just so you know, if you try to claim the disability tax credit in years after it's expired, it is all automated. It's attached to social insurance numbers. They will reject the tax return if you make a claim for an expired disability tax credit, whether it's for yourself or it's being transferred from a dependent child to a parent. They track this very, very well. We talked about the impact on prior year tax returns. Absolutely, in the application process, make sure that you select that you want prior years to be reviewed or recalculated. And then lastly, what can you do if your application is denied? The CRA, unfortunately, is terrible when it comes to feedback, and they will not send you a notice and say, your application was denied because you did not show X, Y, or Z. They will just send you back a notice, likely saying that it was rejected, and you're free to try again if you like. If something changes, so you are able to try again if something changes, but you are also able to do things like file an appeal or an objection. And you can, if you firmly believe and your qualified medical practitioners firmly believe that you presented a strong enough case, if they can give you more, if you have other documentation that you may be held back when you sent the information through, this is now your chance to go ahead and send more documentation for another evaluation of your application form. And that's why a few minutes back I said, if you have a lot of documentation, send it right away. Don't say, let me just send this and see what they say. Send it all right away, and it'll probably help you further along in the process. And again, once upon a time, this used to take 6 months for the CRA to evaluate and make a decision. I've heard that they've automated the process, so it's now online. So it could be a little bit shorter. They could be backlogged just because of what we've been dealing with for the past couple of years. So the more you can do to help you from the get-go, the better. So now the next piece, of course, is it worth all of this work, right? I mean, so it is a lot of work to be successful in this process. But, for me, for example, I was in the thick of so many different things, whether it was treatment or trying to figure out why my son wasn't hearing or speaking or his vision. I was already in the midst of it and collecting, these assessments as I went along. He had medical folders all over the place. So for me to decide to do the application, it was just a matter of then going back to each of these particular medical professionals and asking for photocopies of my son's file so I could take it to his doctor and say, hey, let's get this application sent off. So it was, in that sense, it was easy, and I knew that it would be worth it because I knew that the dollars behind the credit are significant. And so just for the sake of demonstration, so that you're aware, the disability tax credit is not, if you get approved, it's not like you're going to get a check for $2,000 or $3,000 automatically every year. The disability tax credit is what we call a non-refundable tax credit. So if you have taxes payable when you do your tax return, if you claim the disability tax credit, it will reduce your taxes payable. Having said that, if the case is that you don't have taxes payable, then the DTC really won't provide any benefit to you unless you can transfer it to someone else who is a caregiver or that can use it on your behalf. So that's important to understand. It's a non-refundable tax credit. The federal amount, these are just BC rates because of when I built this particular presentation, but the federal rate is again the same across the country. It doesn't matter. The provincial amount is in and around $8,000 regardless of the province. So what that means, for an adult, it's around $1,500 to $2,000 in non-refundable tax credit. If you are a parent claiming it for a dependent child under the age of 18, in addition to the federal and provincial amount, you can also claim a supplement for, it's around $5,000 federally and $4,800 provincially. This amount gets reduced by any childcare expenses that you do claim for this particular dependent. So they do a little bit of netting against for the supplement. But if you are a parent with a child, the total of both could get you around $3,000 per year. So again, $3,000 for a parent with a transfer, or $1,500 to $2,000 non-refundable tax credit if you yourself are the individual who's claiming the disability tax credit. So again, it's probably one of the largest tax credits that the CRA does offer, which is why the steps and the process that you have to go through to be successful is so incredibly laborious, and why it's so heavily scrutinized. Okay. So that's the dollars and cents behind it. What you want to consider, in addition to the DTC is, if you feel like you won't be successful, you can always explore other credits, the amount for eligible dependents, the Canada caregiver amounts for a spouse or common law partner, home accessibility expenses, the Canada caregiver amount and supplement for dependents over the age of 18, regular medical expenses, which we're going to talk about in a second. And of course, the child disability benefit is also something that you get, which is I think $50 more than the regular child benefit, but you have to have a disability tax credit approved on file to receive this version of the child benefit. The next common question that a lot of people ask, can I claim both medical expenses and the disability tax credit? The CRA says no. So it's important to understand that you've got to do a little bit of math here to figure out what's more beneficial to you. These are just some very common medical expenses that the average Canadian taxpayer could have. Thinking about what we looked at here in terms of dollars and cents, if you have medical expenses that exceed $8,000, it's actually more advantageous for you to claim the medical expenses than the disability tax credit. So you've got to really kind of assess your own personal situation to determine what's going to be more worthwhile to you. And, for the parents that are on the call, if you are spending aggressively on things like tutoring or any other supports that you have a note, for example, that is required to support the dependent child, this can very easily add up. So you've got to figure it out. If you're spending over the $8,000 or $9,000 per year on medical expenses, it might not even be worth it for you to go ahead and apply for the disability tax credit. So knowing your numbers and your expenses is really important to determine if you're going to move forward. And again, just expanded on, because we're talking about neurological disorders, just some of the types of tools and supports that qualify. If you do have a diagnosis of ADHD, then you can make a case for claiming, in addition to traditional medical expenses, additional items like support services, like for your computers, things that help with language and whatnot for education, tablets, so on and so forth. So I wanted to add this into the presentation just so that you understood it was a combination of traditional medical expenses plus additional for neurological disorders. But again, it's just key to remember that having a note from a medical professional supporting the need and for the use, you should have it on hand. You don't have to send it in when you do your taxes, but if you ever get called on to justify why you claimed so much in medical expense, you have the letter, you send it in, and nobody adjusts or reassesses your tax return. So what happens next? We have got 15 minutes to go. So first things first, this is a lot of information. There's a lot to think about. So if you haven't yet even started thinking about the application, or you haven't even looked at the application, my hope is that this was informative, but that you can now maybe download the materials again and kind of go through it, and even go onto the CRA website and actually download the T2201 form yourself and take a look at it and start to assess yourself or whoever's being applying for this particular for the disability tax credit, to see if you can get a sense of, will you be able to demonstrate this restriction in the daily basic activities of life? Will you be able to demonstrate that it's a prolonged impairment? Is it present 90% minimum of the time? So this is where you come in and say, you know what, I think we can hit this, and I have the team that is going to help me to do this. And then you go ahead and move on to the next steps. Again, it's figuring out who is going to be the best advocate in this process for you. If you have a doctor who isn't going to be the best person to support you here, again, you have a list of medical professionals who are able to sign the application for you, and you might need to spend some time to go and meet and present and bring medical files and documentations and start somewhat all over again. But there's no legislation in Canada that says that a doctor has to complete the application form for you. And I know that that's a question that comes up often. What can I do if the doctor says no? The answer is that you can't force them. And I know I wish the answer was different, but that's the actual, unfortunately, that's the answer. And then lastly, if you are able to get someone to complete the application for you, they will prepare the T2201 with all of the documentation that has been provided and prepared and that you brought forward to them. They will send it, the CRA will review it, and send you back your response within a few months of the process. So high level, those are your next steps. It's a lot of work, it's a lot to absorb. But it's, again, one of the largest credits that the CRA offers, which is why it's just so incredibly different than applying for many of the other credits that the CRA does offer. And I wanted to put up some FAQs. These are just questions that often come up when this webinar is done. So number one, we covered this already, but can you claim both medical expenses and DTC? No, you can only claim one. Can I transfer? So what I didn't include in here is that if you do get qualified or approved for the disability tax credit as a parent, or even for an individual, you could actually also open up an RDSP, which is similar to an RRSP, but this is very specific for individuals who qualify with a disability. This is extremely controlled by the CRA, because the CRA does put money into the registered pension plan annually, potentially up to $3,500 per year. But there's a lot of rules surrounding the management of an RDSP. So you really have to go to your financial institutions to get strong guidance in terms of whether or not you should or shouldn't pursue opening one, and what all the tax impacts are, because there's a lot. But one of the questions that often comes up is, if I have a child that I had built up an RESP for, can I then transfer it and they don't go to school? Can I transfer it to an RDSP? And the answer is yes, you can. Another question that comes up is, are there any additional post-secondary bursaries? Yes, there is the bursary for students with disabilities, but what I want to make clear is that being successful with the CRA for the disability tax credit does not necessarily mean that you will get an immediate acceptance for any bursaries for post-secondary education. They are two independent things. One is federal, one is provincial. So success in one doesn't mean success in the other, but they do exist and you can apply. Another question that often comes up is, can you transfer the disability tax credit? So yes, you can. Like I said earlier, for a child, you can obviously transfer it to a parent. You can also do it for dependents over the age of 18. If you are a caregiver and the individual so qualifies for the disability tax credit. And at what point, the next part is, at what point do you stop claiming it as a parent and let your child claim it? And the answer is really when a child has taxable income and it makes more sense to reduce their taxes payable, that's the point at which you stop designating the transfer and have the actual individual claim the disability tax credit. So you have to really learn to kind of manage and assess who has taxes payable. Do I have taxable income that it makes sense for me to make the claim, or can I transfer it to a caregiver? But it can move between caregiver and actual recipient, or the individual who has the actual disability. Would an RDSP be retroactive to the date of diagnosis? And I said yes, because I covered this in the very beginning. And again, can I force my doctor to sign the forms? And unfortunately, the answer to that is no. And so we have 10 minutes left, and I can see that the chat is hot. So I'm going to maybe ask Annie if you want to go ahead and ask some questions, and I will do my best to answer whatever I can off the fly. I will absolutely answer.
So thank you very much,
I know
Stefanie. It was
a
lot of information, but it's great information. So I'm going to start off by the one question is, how would you claim issues related to emotional dysregulation and ODD?
So again, I mean, that's under the purview, if I understand correctly, probably of a psychologist. So it goes really back to having that psychological evaluation or assessment done. And again, they will go through very specific assessment criteria to determine what the impact of that diagnosis is on certain functions of the brain.
Okay, thank you.
No
and
problem.
I know, and just to let everybody know, Stefanie can't necessarily answer all questions, but she's doing a great job at doing so. So I thank you very much. A question about the appeals. So somebody was recently denied the disability tax credit due to the fact that medication is showing to be helpful. So the CRA is saying it's not severe enough, but what about the fact that in the past, prior to medication, there was struggles, there was lost jobs, there was, how can you go ahead and make an appeal based on that?
So what I would recommend is can you prove the date that you started medication? And then go back and basically argue that, okay, I don't want to apply for effective today or as of 2022, for example, but I want to go back to the date of my diagnosis. And if that takes you back to 10 years, remember, there is a 10-year limit. And if we go back 10 years and for 6 years, you were not on medication, then what you want to explain is that for those 6 years, I was not on medication and I was restricted as the documentation shows. So for those 6 years, I should have been granted the DTC.
So in other words, though, Stefanie, they need to have that diagnosis.
Oh yeah, absolutely. Yeah. Absolutely. Without it, it's impossible. Absolutely.
Okay. And so what if the diagnosis of, let's say, so if we're talking about a child, the diagnosis of a speech impairment is dated before the ADHD diagnosis?
It's okay.
Okay.
Yeah, because remember, the speech is one of the basic functions of daily living. So that's a metric that they're measuring, right? It could be any one of them. It doesn't matter.
Okay. So they could go back to the speech impairment first.
Absolutely. Yep. That could be the starting point. Exactly. Yep.
Sorry.
That's okay.
And I apologize to everybody because I am ill, so my throat's going. So one question for speech, it lists behavioral therapy. So does speech include that your ADHD makes you impulsively blurt things out that cause you social acceptance issues, or is the speech part literally about being able to talk?
I would say that I can't probably answer that one because it's probably a little bit more specific. But again, if you can get someone to attest to a function that creates a struggle in terms of speech, then that's what you want to try to achieve. And behavioral issues, depending on how they are documented, they can also be utilized.
Okay, so another question is, how is markedly restricted different from significantly restricted?
So remember, the CRA, they keep all this stuff very close to their chest. My interpretation is that if I super quickly scroll back up here, I believe that markedly restricted is here, severe, and significant is probably a combination of moderate and moderate to severe. That's what I believe the metric is. Which is again why understanding where your practitioner is going to chart will help you to understand if you're going to be successful.
Right. So there's a comment here, and you know, I so understand this comment, and I think many people struggle with this. So it's kind of ironic how it takes so much executive functioning to fill out this, to qualify. So are there agencies that can help people?
This is a great question. Yes.
That wasn't necessarily the whole question, but
okay.
That is part of the question. You know, like I've added that to it because I know as the resource navigator for CADDAC, I've heard that, right? So
Good.
are there agencies?
So there are agencies, which is great. They usually take a fee. If you are successful, they'll take, again, because you can go back 10 years. I can candidly say I was able to get 5 years worth at one time, and I believe they sent me $16,000. And so it's a lot of money. And so these agencies could take maybe 10%, 20%, whatever it is that they feel is a fair amount. So that's an option. I just want to be very, very clear and tell you all that what I've heard are some nightmare stories, that there's a lot of scam companies out there. So please, if you choose to pursue this, just be very careful that they're not going to lie on your application, because if they lie, they are not liable. You are liable as the taxpayer. If they lie and they run off with your money and the CRA sends you $16,000 that they shouldn't have, you have to pay that money back. So I just want to make sure that I'm very clear, because I've heard some horrible stories.
That's very good to know. Thank you.
Yeah.
Somebody has a past assessment confirming diagnosis, but currently under the care of a professional other than GP who is not trained, so doesn't have training. The GP doesn't have training in ADHD. So should they find another professional before attempting to get the forms completed?
I would say if you have an assessment, why not just use the one that you have? If you have an assessment, take that to your GP and they will just add that to the package, and that covers that. My son's GP didn't attest to his mental functions. I had a document similar to this person, I think, from a developmental pediatrician who certified the ADHD diagnosis. So I just took the form from him and gave it to the GP. So if you have it already, you don't need to pursue it again.
Excellent, thank you. Let me just get back to the chat. Oh, I have to go back up, sorry.
It's okay.
Then another question is, do they need, sorry. Oh, what if you are twice exceptional? Being gifted makes it easier to mask, but doesn't help you in terms of the ADHD tax, which is the point of getting the tax rebate, that your disability costs you more money than the average person.
I mean, that's probably in the arena of mental function. And if you can get a psychological assessment from a psychologist that will attest to this double effort and how it's significantly impacting your life, then that's what it would take to probably try to be successful under that, with that criteria.
Okay, thank you. What if date of diagnosis was as a child and now you're an adult at 45? Are you saying you could only go back 10 years?
Yes.
Okay.
10 years is the limit.
Okay. And sorry, I lost one that I wanted to read. My cursor is just not working for me.
Mine was struggling too. I don't know why.
Somebody wants to know if by doing this tax disability form about themselves, will it be possible for anyone to use it as proof that they can't be a good mom for their children? So is there any disadvantage, I guess, to doing it about your own self?
I mean, I can't imagine why having an ADHD diagnosis or any of these other quadrants would impact. But I mean, this is private. You don't have to tell anybody that you're doing this. So, you don't have to make this common knowledge to be shared, or if you have concerns about it being used against you. I can't speak enough to like the legal system to say, I just can't imagine why one would impact the other.
And can it ever be used in a court of law about divorces? So, when it comes out about what, yeah,
like only in the sense of like who as a parent can claim the tax credit. I think there needs to be an agreement in terms of who is going to claim it on their tax return, because only one of the parents can, and typically it's the higher earning spouse who will claim it, but that's in a marriage. In a divorce or separation, I believe you have to go ahead and designate which individual is going to claim it.
Okay. Can you renew after it expires?
Yes, good question. So if you get to your year of expiration and the conditions are still present, you have to go through the entire application process again. Because basically what the CRA wants to see is that the condition is still present and it hasn't improved. So it's you're not going to take the same form and send it in again. You have to go and get all of those assessments done and see if you still chart in the same area, with the same levels.
So it could be increased, it could be decreased.
Correct. Right? I mean, for my son, I didn't renew the application because I knew that I wouldn't be successful. It just expired this year and I wasn't going to be successful, so I did not reapply.
Okay, thank you. Can the assessment be accepted by a school psychologist?
Yeah, as long as they're a certified psychologist, of course. Yeah, absolutely.
Okay. So in the medical expenses, can they include therapies that have been covered by a job benefit plan?
If the general rule, no matter what, for medical expenses is that if they've been paid back by your benefit provider, you should not be claiming those expenses. You can only claim the portion that your benefits did not cover.
And this comes back a little bit to the question previously. So when you're talking about 90% of the time, what if she is taking medication and does better?
Right.
But can we try to apply by saying without this medication, this is what would happen?
Yeah, absolutely. Of course.
I need this money to be able to get the medication.
Absolutely.
Right.
Absolutely. Yeah. Yeah. I mean, and this is where I say, not be creative because I'm a CPA and I can't say that. But again, you have to be your own best advocate. And if you think that it's going to be, if you put the medication in here and it's going to look like the condition is not present, then don't tell them, don't list the medication. Just say what the actual reality of the impairment is, whether or not we've chosen to put the child or ourselves on medication is neither here nor there. But this is what my life is like, basically. right?
So somebody actually wrote that comment that they sat with their pediatrician to fill it out. And the pediatrician told him to think of his worst day with his son and use that to complete the questions. And
Yeah,
they got
absolutely.
approved on the first try and within 1 month. Good for you.
That's
And they
amazing.
backdated it 8 years. So you got really lucky.
Yeah, absolutely.
Somebody's asking, to be clear, this is only of use to people who owe money in their taxes each year.
Yes.
Yes.
Yes, yes, right, because it's a non-refundable tax credit. So it serves to reduce your taxes payable. If you don't have taxes payable, claiming this you won't get $3,000 or $2,000 in the mail. Doesn't work like that.
Okay. So how about claiming medical expenses for parents and DTC for child? Or is
Sure.
it, yeah?
No, yeah, absolutely. Two different scenarios.
Okay.
Yeah.
Are we good to continue for a little bit, Stefanie?
Yeah, sure. Let's do a couple more. Absolutely.
Okay. How does a DTC expire?
They they decide what your expiration term is going to be. I've read that for neurological disorders, they actually try to average it around 6 or 7 years if it's a child, just because as the brain develops, things might change and they want you to come back in, reassess and see. Mine was 10 years off the hop. If you're older and you've been in the condition for let's say already 15 or 20 years, they may just give you a longer because it's clearly demonstrated that there isn't going to be an improvement. But again, then remember the CRA holds this very close to their chest. So they don't give you the matrix to show where they're going to land on their decision making. It's arbitrary to a certain extent.
And does it seem like it might be age related?
I think so.
Yeah, like as children grow out of certain phases, sort of thing.
Yes. I think that the children usually get a shorter to start and maybe an adult will get a longer.
Okay.
Yeah.
So talking about adults, do you have more information for adults or is it all the same?
It's all the same. What they're looking for is the same type of assessment. The formula that they're judging everybody on, it doesn't change, right? So regardless of age, as long as you can show the restriction and the prolonged and being present 90% of the time, it's irrelevant. It's a matter of the documentation that you can provide for your case.
Okay, thank you. Somebody's asking, and I'm going to answer that. Who can diagnose ADHD? So just so that you know, a psychologist can assess, diagnose, and treat with therapy. They usually cost anywhere between $1,000 to $4,000 for an assessment. A psychiatrist can also diagnose, and they're usually covered by your provincial health insurance program. But you do need a referral from a general practitioner to see a psychiatrist. A psychiatrist can assess, diagnose, and treat with medication. It's usually a short time visit. They don't usually do a lot of follow-ups because they're overloaded. And then, yes, pediatricians can also assess, diagnose, and treat with therapy or treat with medication for children. And there's some just lost the word. Neurologist. I think I need a neurologist right now. Neurologists who will also assess and diagnose. And so if you need more information on that, do not hesitate to email me and I will put my info in here. I have a list of these specialists that I can provide to you. So you can reach me at info@caddac.ca, or you can go on our website to get more information about the process. Okay, that's my job. That's what I do. I've answered 200 emails in October, basically just on that, where people could go and find assessments and stuff. So would single-sided deafness be considered a disability when it comes to applying for this credit?
I don't necessarily know specifically what that means, but it sounds like it's possible. If you can demonstrate the market or significant restriction. I don't know if that's genuinely vision and hearing, if that's what that means, but if it is, absolutely.
It means completely deaf just in one ear.
I would imagine that it's possible, as long as you can attest to how that impacts your ability to live on a daily basis. Yeah, absolutely.
Okay. So what types of therapies are accepted? And what about what is not accepted? So is naturopathic accepted? Is massage therapy accepted? Acupuncture?
In terms of for like a medical expense?
Not sure, possibly.
I would, I mean, so absolutely. Again, the caveat for claiming these things for the CRA is that the rule is supposed to be that a medical practitioner has certified in writing that the therapy is required for the individual to support them as a result of their diagnosis. That's the answer that I'm supposed to give you as a CPA.
I like that answer. Okay, I'm just trying to see. Some are more personal. Can you combine an ADHD claim with a completely different disability that is also present to get 100% impact on daily life?
Yeah, of course, absolutely. Yeah. And remember, that's exactly what I did for my son, right? We had four impacts that went into our application form.
Okay. And if the applicable disability was diagnosed mid-year, will the credit be prorated to only half the year?
I don't think so. No, because my son was diagnosed in June and they restated or I was able to restate my entire 2012 return. So no.
And let me just check something. Sorry. So we have a call-in user. Just want to make sure.
Sure.
If the call-in user has any questions. She can't put it in the chat. If you do, you could go ahead and unmute yourself. And if you don't, I will save the chat. Oh, one last one is, what if an adult supports his 32-year-old daughter because she keeps losing her jobs? And you know what, I have to say, this is a common question that I'm getting all the time, Stefanie. So what if an adult supports their 32-year-old daughter or child because they keep losing their job or going on disability because of the ADHD and ODD? Can he get a tax deduction or the DTC?
If the individual, so if the daughter.
No, can the parent get?
No, right, sorry. But I mean, if the daughter is approved for the DTC, then technically, yes, as a caregiver for someone over the age of 18, you could accept the transfer of the credit, but your daughter would need to be approved, obviously, first for the credit for that to happen.